Assalamu alaikum. In today's video, we will master pharmacology of alcohol. Keep in mind the following landmarks. So let's get started. Alcohols. For example, ethanol is mainly a sedative hypnotic drug. It is the most important alcohol of pharmacological interest. Some other alcohols like methanol and ethylene glycol, they are important because of their toxicological effect. Before getting started, let's have a look at the pharmacokinetics and metabolism of ethanol. After ingestion, ethanol is rapidly absorbed. Two enzyme systems in our body metabolize the ethanol into acetaldehyde. The first one is alcohol dehydrogenase system and the second one is microsomal ethanol oxidizing system, MEOS in short. In alcohol dehydrogenase system, alcohol dehydrogenase enzyme metabolize the ethanol into acetaldehyde using NAD positive as a cofactor. NAD positive is hydrolyzed to NADH. Now, acetaldehyde has further toxicological effect in our body, so it is important to metabolize acetaldehyde into some other products like acetate with the help of enzyme aldehyde dehydrogenase. Aldehyde dehydrogenase also uses NAD positive as a cofactor which get hydrolyzed into NADH. Now, the product acetate is further converted to acetyl-CoA with a couple of enzymes. Now, there is an important disease associated with the aldehyde dehydrogenase enzyme, that is the alcohol flush response. If due to any reason aldehyde dehydrogenase enzyme become deficient, it causes acetaldehyde levels to raise up in the body, resulting in catecholamine release, which causes flushing, means red face, rapid heart rate, headache, runny nose, hives and stomach pain. 90% ethanol is metabolized in the liver. Remaining ethanol is metabolized by microsomal ethanol oxidizing system. It also occurs in the liver. This metabolism occurs so rarely, but when ethanol level becomes so high in our body, this metabolism becomes important to lower the toxicological effect of ethanol. Microsomal ethanol oxidizing system also occurs in the liver. Enzyme CYP2E1, which is a cytochrome P450 enzyme in smooth endoplasmic reticulum, it converts the ethanol to acetaldehyde, then acetaldehyde is further metabolized by CYP2E1 or aldehyde dehydrogenase enzyme to acetate. This CYP2E1 during metabolism produces reactive oxygen species that cause DNA damage. This CYP2E1, when further exposed to higher level of ethanol for longer period of time, it becomes upregulated and create tolerance, becoming the major symptom of alcoholism. Now, what is the mechanism of action of alcohol in our body? First, it binds to ligand-gated GABA receptor, increasing its function of hyperpolarization. Secondly, it binds to NMDA glutamate receptor, decreasing its depolarizing action. In this way, alcohol causes decrease in the action potential, resulting in sedation and hypnosis. Now coming towards the effects of alcohols, it causes both acute and chronic effects in our body. Alcohol causes dose-related acute effect in our body, means if alcohol concentration is between 60 to 80 mg per deciliter, it causes impairment of driving in non-tolerant person, slurring of speech and ataxia. If blood alcohol level is between 120 to 130 mg per deciliter, it causes increased sedation and decreased mental activity. Alcohol level greater than 300 mg per deciliter causes the loss of consciousness, profound respiratory depression, cardiovascular reaction resulting in the coma. Blood level higher than 500 mg per deciliter is lethal and cause death of the patient. These acute effects can be treated by maintaining the vital signs and prevention of aspiration after vomiting, correction of electrolyte imbalancement, and long-acting benzodiazepine, for example diazepam. It reduces the chance of reoccurrence of withdrawal symptoms. Alcohols also causes some chronic effect like liver disease, peripheral neuropathy, Wernicke-Korsakoff syndrome like ataxia, confusion, paralysis, pancreatitis, gastritis, heart disease, fetal alcohol syndrome, which include number of symptoms like mental retardation, growth deficiencies, microcephaly, thin upper lip, and short midface in the children, tolerance, neoplasia with the increasing risk of breast cancer, decreasing the immune cells making the patient susceptible to pneumonia, and last one is endocrine disorders like gynecomastia and testicular atrophy. These chronic effects can be treated by using acamprosate, an NMDA glutamate receptor antagonist. It is the drug of choice or first line of drug. It maintains the balance between the glutamate and GABA, decreasing the craving of alcohol and maintaining the abstinence in alcohol-dependent patient. The second drug is naltrexone. It is an opioid antagonist. It limits the amount of alcohol someone drinks. It works by blocking the opioid receptor, inhibiting the effects of alcohols. Another drug that can be taken is disulfiram. It is the second line of drug. It is given after the withdrawal symptoms have been subsided. Disulfiram works by demotivating the patient by causing unpleasant physical reaction if the patient take alcohol. It inhibits the aldehyde dehydrogenase enzyme, increasing the level of acetaldehyde in the body. Increased level of acetaldehyde cause diaphoresis, palpitations, facial flushing, nausea and hypertension. This aggregation of symptoms is known as disulfiram-like reaction and discourages the alcohol intake by the patient. If we stop alcohol suddenly, it causes alcohol withdrawal syndrome, showing the symptoms of headache, craving of the drug increases, clammy skin, shakiness, fatigue, appetite loss, and difficulty in thinking. These withdrawal symptoms can be treated by correction of electrolyte imbalance, administration of thiamine, and sedative hypnotics to treat ataxia, insomnia, and other CNS symptoms. Long-acting benzodiazepine, for example diazepam, chlorodiazepoxide, is preferred in patients with healthy liver. It binds to benzodiazepine site at the GABA-A receptors, enhancing the GABA function, resulting in hyperpolarization and CNS depression. If patient has compromised liver function, then short-acting benzodiazepine, for example, lorazepam, is preferred. That's the end of my today's lecture. Hope you enjoyed this video. See you in next one.